Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Ever wondered about, the shortcuts that some people take to get ripped really fast? Well, today we're going to be doing a deep dive into a study about anabolic androgenic steroids and their effects on heart health. It turns out this recent study from Denmark that was published in the journal Circulation has uncovered a pretty alarming link between steroid use and a higher risk of heart problems.
It is fascinating how this study actually focuses on the long-term consequences, not just the immediate impacts of steroid use.
Yeah, and to make sure we cover this thoroughly, we've got both the actual study, Cardiovascular Disease in Anabolic Androgenic Steroid Users, and a news piece from Medical Express. Long-term study reveals extreme heart health risks in steroid users. So before we jump in, can you just give us the rundown on exactly what these steroids are?
Anabolic androgenic steroids are essentially synthetic versions of testosterone. That's the male hormone found naturally in men, and people use them to try to get bigger muscles and increase their strength. While they might see some gains quickly, it's the impact years down the line that is a real concern, particularly when it comes to their hearts. And it's also important to remember that these substances are actually banned in professional sports.
Right, and this study really zeroed in on that long-term impact, right?
Yeah.
So tell us about how they went about doing this research.
Yeah, so they followed over 1,100 men in Denmark who were actually penalized for using steroids between 2006 and 2018. And these men were then compared to a group of almost 60,000 men from the general Danish population that had a similar age and sex. They wanted to see how their cardiovascular health, basically the health of their hearts and blood vessels, compared over an average of 11 years.
Okay, so they tracked these two groups over a pretty long period of time. What did they find?
Well, the study revealed that men who had used anabolic androgenic steroids had 3 times the risk of acute myocardial infarction.
Now, I know you said we're avoiding acronyms, so for those of us who aren't doctors, what exactly does that mean?
Acute myocardial infarction is just the medical term for what we commonly know as a heart attack. It's a life-threatening condition where the blood flow to part of the heart is blocked. And remember, this risk was 3 times higher in the group who had used steroids.
Wow, that's a really significant difference. What other risks did they find?
Well, they also found that men who used steroids were nearly 9 times more likely to develop cardiomyopathy, which is a serious condition that weakens the heart muscle. And this weakening makes it harder for the heart to pump blood effectively throughout the body.
That sounds extremely serious. So it's not just about the risk of an immediate heart attack, but also the potential for long-term damage to the heart itself.
Exactly, and the study didn't stop there. It also looked at a whole range of other cardiovascular problems like coronary artery bypass graft, which is a major surgery to improve blood flow to the heart. Also, venous thromboembolism, which is the formation of blood clots, often in the legs. That can be incredibly dangerous.
So we're talking about just a whole cascade of potential heart problems that are significantly more likely in people who have used steroids. What about irregular heartbeats?
Yes, the study found a higher risk of those too. They're medically referred to as arrhythmias, and they can disrupt the heart's normal rhythm and potentially lead to more serious complications. They also looked at heart failure, a condition where the heart can't pump enough blood to meet the body's needs. And again, the risk was significantly higher in the group that had used steroids.
It seems like these steroids really just wreak havoc on the entire cardiovascular system. And what I find especially concerning is this part of the Medical Express article that mentions that a lot of these problems didn't even show up right away. A lot of them surfaced years after the men had been penalized for steroid use.
That's a really crucial point, and it highlights that the damage caused by these drugs can be very long-lasting, with consequences surfacing even years after someone has stopped using them.
So we've got a pretty clear picture of just how dangerous this stuff can be. But what is it about these steroids that makes them so harmful to the heart?
Yeah, that's a great question. And while scientists are still trying to figure out all the exact details, we do know that anabolic androgenic steroids can negatively affect a lot of things that are key for a healthy heart. Like they can really drive up blood pressure, and they can mess with cholesterol levels, and both of those are major risk factors for heart disease.
Oh, for sure.
They can also make it more likely for blood clots to form, which can lead to conditions like that venous thromboembolism we were talking about earlier. And get this, they can even change the actual structure of the heart muscle, making it weaker and more vulnerable to disease over time.
So it's like they're setting off this chain reaction of negative effects through the entire cardiovascular system. It makes you wonder if they're things people who have used steroids can do to kind of mitigate these risks?
That's a really important question, and it's one that healthcare providers need to be more aware of. Early detection and intervention are key, but that requires open and honest conversations between patients and their doctors.
So even if someone used steroids in the past but feels fine right now, they shouldn't just assume everything's okay.
Exactly. They should absolutely talk to their doctor about their past steroid use. The doctor can assess their individual risk factors and then recommend appropriate screenings or even just lifestyle changes to help reduce the chances of developing serious heart problems later on. And remember, this study showed that those negative consequences can sometimes take years to show up.
Yeah, and that's where I think the news article brings up an important point about some of the limitations of this particular study. For example, it only looked at men, so we don't really know how these steroids might affect women's hearts in the long run.
You're absolutely right, and that's definitely a gap that needs more research. There are also some other factors that weren't accounted for in the study, like their diet and exercise habits and whether the participants were using any other drugs. All of these things can have a big impact on heart health as well.
And it also sounds like they couldn't get super specific about how the dosage and duration of steroid use might have actually impacted the level of risk, right?
That's another limitation. We can't say for certain just based on this study alone whether higher doses or longer periods of use lead to even greater risks. More research is definitely needed to really pinpoint those connections.
So even with these limitations, what was the overall message from the researchers who actually conducted this study?
Well, even though the study does have those limitations, the authors are still calling for increased awareness among healthcare professionals. They're basically saying that we need to start asking about a history of anabolic androgenic steroid use as just a part of regular medical checkups and screenings, especially for young men who might be more likely to, engage in this kind of behavior.
It makes sense that they'd focus on prevention, especially considering how serious these consequences can be.
Absolutely. They're urging public health officials to really ramp up efforts to educate people, especially young men, about the long-term risks associated with anabolic androgenic steroid use. They're advocating for campaigns that really challenge that glorified image of steroid use that we see so often in fitness and bodybuilding circles.
It seems like a lot of this comes down to just changing the culture around these drugs and how people view them.
Yeah, a big part of it is promoting healthy approaches to fitness and, body image and just making sure that young people especially have accurate information about the risks involved.
This study was about the men who got caught using steroids, right?
Mm-hmm.
But, what does that tell us about the bigger picture?
That's the huge question, right? I mean, if these were the ones who were caught, imagine how many more people might be using steroids and just flying under the radar, It really suggests a much bigger problem than we might realize and raises some concerns about long-term monitoring and healthcare needs for anyone who might have used these drugs, even if they've stopped.
That's a really sobering thought. So it seems like the key takeaway here is that the risks are just way too high when it comes to steroid use.
Definitely. I think this study really drives home the point that while these drugs might seem like a quick and easy way to achieve a certain physique, the potential cost to your health, and especially your heart health, is just incredibly high. And you know what else? Those consequences can really stick around for years and years, even long after you stop using them.
So for anybody listening who might be thinking, well, I've used steroids in the past, but I'm feeling okay now, what advice would you give them?
Well, it's awesome that they're feeling healthy now, but considering what we now know about those delayed effects, it's super important to be proactive. Don't just assume everything is fine. Schedule a checkup with your doctor and be upfront about your past steroid use. They can really help you understand your risk factors and recommend any necessary screenings, or even just suggest some lifestyle changes that can protect your heart health down the road.
This deep dive has really been eye-opening, and it highlights that when it comes to our health, there's really no substitute for taking the long view.
I totally agree. Knowledge is power, and knowing the risks involved is absolutely essential to making good decisions about our bodies and our well-being.
Well, we hope this exploration of anabolic androgenic steroids and heart health has been informative and helpful. It's a good reminder that achieving fitness goals should never come at the expense of your long-term health. And remember, there really are no shortcuts when it comes to something as important as your heart.
Thanks for tuning in to the Health Headliner podcast by To-Do Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.